And vectors are going to look very similar to each other. And one is going to be passive, one is going to be active. They are both sciatic nerve stretch / nerve root tension tests. So these are both going to be looking for sciatica, neuropathy, or radiculopathy. And so they correlate well, especially seated. The sag correlates really nicely with the straight leg raise. So maybe you want to make sure to verify your findings. Maybe someone's potentially malingering and you're thinking, I better find out if they're telling the truth. You can follow up with something like seated lesauge to make sure that they do in fact have those symptoms that they're reporting. Do you mind being our patient since we're seated right here? So come down to the end of the bench, please. And so your patient is seated, and for seated lesauge, this is going to be passive on the part of the patient. So the doctor will be doing the action. You're going to stabilize the thigh to keep it from coming up. You also want to sort of look peripherally to see if the patient is still sitting upright, or if as you lift the legs, you're just going to be passively lifting the leg and seeing if they get any symptoms with that. And so sometimes when someone has symptoms, as you're trying to lift it and it's starting to hurt, they might kind of do one of these numbers because they don't want that nerve to be stretched. So sort of look for that. That in itself is not the positive finding, but it's worth noting. And then we're going to stabilize the other leg, lift up, and then scoot your knees together. We're going to stabilize both of them and then lift both of them together. So that's going to be seated lesauge, passive on the part of the patient. The doctor lifts the symptomatic leg, lifts the asymptomatic leg, and then if they still don't have the symptoms, lifting both together. Vectors, you're going to ask the patient to do. You're going to still stabilize to keep the thigh from coming up, and I just want you to straighten your leg out in front. Okay, good. And then straighten the other leg. Good. And then lift both together. And that is vectors. And so that one brings in a little bit of that intrathecal pressure as well, so that can be a little more sensitive if they have radiculopathy from a disc herniation or something of that sort. And then slump test is if someone has maybe just a small herniated disc, and so it's sometimes causing symptoms, sometimes not. Your tests are maybe not coming out positive, but the history really is making you really think that they have a disc going on or something happening at the nerve root level. You can add the slump test. So that's going to be two-leg version of vectors, so bring both legs out in front. I want you to tuck your chin to your chest, we're going to add lormeets to that, and then bear down. And then we add Valsalva. So that's kind of throwing everything at it. So we're stretching that nerve maximally, and then adding intrathecal pressure to that test to see if that can elicit those harder to find dermatomal symptoms. All of these are looking for sciatic symptoms going to the leg below the knee, suggesting sciatic neuropathy or radiculopathy, and that would be your true positive finding. All right, so let's have you guys practice that in the next 2 minutes.